Welcome to See Arthritis. I'm Maya. I'm joined today by Dr. Ray Young, who presented as a part of a very exciting session at the CRA called COVID-19 and Rheumatic Disease, Can We Recover and What Can We Uncover? She spoke on the topic of multi-system inflammatory syndrome of childhood, which is also known as MIS-C. Thank you so much for being on our program today, Dr. Young.
Well, thanks so much for having me.
So to start, can you tell us a little bit about yourself and how you are involved in rheumatology?
Yeah, sure. So I'm a pediatrician looking after kids with autoimmune disease, including arthritis and rheumatic diseases. And it's interesting. I'll make it the short version of the interesting story. The focus of my work is actually research. So I'm a clinician scientist at SickKids, and I trained in immunology, basic research. And as you know, the immune system is so critically important in all of our rheumatic diseases, including arthritis. So as I was studying in the lab doing my PhD in immunology, I clearly recognized that I need to make it very, very relevant to the patients that I look after. And as a pediatrician, the really one big specialty that screams out at you is pediatric rheumatology as the area to be in. So it was after a really kind of a fortuitous set of kind of surprises that led me to pediatric rheumatology. It's a wonderful subspecialty with wonderful people in it, and the patients are lovely too, with diseases that exactly need the type of expertise I have in the lab. So what I studied is exactly applicable to the diseases that I'm looking after, making it really a lovely marriage of the patients I see in the clinic as well as what I study in the laboratory.
That's great. It's a perfect combination and really ensures that research, is meaningful and relevant to the patients, and because you're working with the patients as well. Now moving to the topic of your presentation at the CRA, I'm wondering if you can explain to us what multisystem inflammatory syndrome of childhood, or MC, is and how it is associated with COVID-19.
Yeah, sure. So it's a fascinating disease because for the longest time, at least at the very beginning of the COVID pandemic, we didn't think kids got severe COVID. In fact, they usually were asymptomatic or had a mild disease. But shortly thereafter, during the height of the first wave of COVID in the EU, people started recognizing that children, about a month after COVID, actually presented with this hyperinflammatory syndrome where they develop fever and they'd really develop the classic signs of inflammation like redness, heat, and swelling in multiple organ systems of their body. And this was very reminiscent of a disease that we see in childhood called Kawasaki disease. So people started calling it multi-system inflammatory disease, a syndrome of childhood, or MIS-C. In fact, there's an alphabet soup of names that people have given it from country to country, but it's really a post-COVID infection syndrome. So you get infected with this SARS-CoV-2 virus about 3 to 6 weeks before, and then suddenly your body's immune system becomes a little hyperactive. And in some kids, it's a little hyperactive, and in some kids, it's dramatically over hyperreactive, leading to quite a severe presentation affecting their heart as well as multiple organ systems. And some of the kids are sick enough to go to the ICU.
Wow, so the implications are quite significant from this.
Yeah.
And now I'm wondering if there are any relationships between MIS-C and arthritis.
So again, a great question, because we know that the lessons that we've learned in MIS-C are kind of all borrowed from Kawasaki disease because it looks so much like Kawasaki disease.
And is that a
And
form of arthritis?
it's a form of inflammation or autoimmune disease,
Right.
and it affects the blood vessels all over the body. And about 10% of kids with Kawasaki disease develop arthritis. So arthritis is part and parcel of their development. And we have a very, very small and yet real percentage that develop ongoing forms of arthritis too. But this is exceedingly rare after Kawasaki disease. What we're seeing in MIS-C is less arthritis. So instead of 10% of the kids developing arthritis and then going away after treatment in pre-pandemic Kawasaki disease, during the COVID pandemic, the kids have gotten much less arthritis. So it's the rare child that gets arthritis during this syndrome, and there is much more affecting their heart and much more affecting their gut. So most of them develop horrible abdominal pain or vomiting and diarrhea together with their fever and their rashes and their inflammation. And it's really their heart and their gut, which is one of the main symptoms that are being affected right now.
Okay. And so you did speak to the relationship of getting arthritis after getting MIS-C or Kawasaki disease, but what about an inverse relationship? Is there any evidence to suggest that maybe kids that already have an autoimmune arthritis might be more likely to develop MIS-C after COVID?
Yeah, again, a great question. And because the good thing is, even though we're talking about it right now, it's still exceedingly rare. So it's not something that you're going to see every day of your life. And even in amongst the kids that are getting COVID, the estimates, and again, these are just estimates right now, is that 1 in 2 or 5,000 children that get COVID might develop this syndrome. And so the numbers are very, very rare right now. And I think I'd be guessing if I told you that kids are at higher or lower risk to develop it if they have had pre-existing arthritis. But we haven't seen that in the cohort that we have. So out of the children that we've seen in the at SickKids, and we've had over 130 kids now with MIS-C since the pandemic began, I can tell you that none of them had pre-existing arthritis. But though the numbers are still small, we really need large numbers in order to be able to know whether there's a difference or not.
Right. And keeping in mind that there are still small numbers and preliminary data, are there other risk factors that seem to be related to developing MIS-C?
So it's another great question. I think many of those risk factors, like many things in rheumatology and arthritis, may be associated with how we're made. So genetically, how we're made, as well as the environment. So the early reports of MIS-C is that it's actually more common in children from the Afro-Caribbean background. But that hasn't borne out, at least in all cohorts. It's definitely been reported in some cohorts. What we are seeing, at least in the Toronto cohort and the Toronto experience, is that there are kids that are from the South Asian communities are being more predominantly affected. Because before the pandemic began, at least for Kawasaki disease, it was actually affecting the East Asian or Oriental kids. And now it's much more the South Asian kids. And it may be associated with the environment because the South Asian communities are actually being affected just as a whole, have been infected by COVID more. So it may be that there's more COVID in that environment leading to that. Similarly, with our Afro-Caribbean communities, it may be that it's affecting those communities a little bit more. So I think there is still this balance and this debate, and a lot of investigations need to still tease out the contribution of how we're made, what ethnicity we are born with biology wise, and where we live. Because if our communities have more COVID in it, obviously we're going to have more COVID associated illnesses.
Right, yeah, and if the community is more likely to be working frontline positions because of socioeconomic factors or systemic racism, for example, that's very interesting.
Absolutely critical factors, and we brought it to attention because of that. And this is quite clear that we need to address this as a society as well as a medical community, because often we can tell from a postal code where kids are coming from, which disease, whether the likelihood of it being MIS-C or not. So it is a very important factor that we need to take into account.
Wow, and also I recall from your presentation, I think you may have spoken about certain age groups, like older children versus younger children. Can you speak to that?
Yeah, so classically, before the pandemic, before COVID-19, kids with Kawasaki are affected much younger. So they're about 18 months to 2 years is about the peak age of incidence. So these are really young children, usually typically under the age of 5. Although we do see young children, it's interesting is that the demographics of it, so the age is a little bit higher for the kids that we're seeing with MIS-C, especially during the second wave of the COVID pandemic. So the kids are about 8 to 9 is really the average age that we're seeing right now. So a little bit older than what we're seeing typically when it was younger.
Okay. And moving forward, it sounds, there's lots of research still in the works. What research associated with COVID-19 and MIS-C, or maybe just COVID-19, if you'd like, what research do you think is most important to explore moving forward?
So I think there are so many unanswered questions, and every answer I'm going to give is going to be biased, but I'll go ahead and be biased. Okay. Is that as a basic scientist, I think one of the things that we don't understand is what is it about the biology that makes certain kids predisposed to getting severe disease versus non severe disease for COVID 19? And similarly, why is it that they get mild disease at the very beginning and then for a month later, why do they get Miss C? And what is it that is about Miss C that makes it your immune system hyperreactive a month later? Like, what is it that's triggering it? It's a month later. It's like clockwork. It's pretty amazing. And Miss C, although we're talking about it like it's one disease, it's absolutely not one disease. There's some kids that get very, very mild Miss C, and there are some kids that get very, very severe Miss C, and they need to go to the intensive care unit. And I wish we have the crystal ball to be able to tell the difference, because when you look at them when they come in, you really can't predict as yet. And it's important to look at the blood work. And that's why where biology comes in, and we need to just study the immune response and study and come up with good predictors that can partner with what we see at the bedside so that we can predict. We can have that crystal ball and predict who's going to be doing worse so we can intervene and give the right drugs earlier to prevent kids from getting sicker.
Right. And so there is some drugs or some treatment that is effective for MIS-C.
Absolutely. In fact, I think we have fantastic drugs. Again, this is borrowing from lessons that we've learned before from Kawasaki disease. So again, the typical drugs that we use to suppress the immune system. And I can absolutely tell you that every single child that we've treated has done well. And their immune response has dampened with basically IVIG is an extract of good antibodies from blood that we give in kids with Kawasaki disease that works for MIS-C. And good old steroids, they also work for MIS-C. They work beautifully for MIS-C, and as well as even biologic agents in the kids that are very, very sick and are recalcitrant to some of the treatments that we give. They respond well to these biologic agents too. So we have the drugs, we have the ability, we just need to be able to predict which kids we need to use them in and when we should use these drugs.
Right. Well, it sounds like, hopefully that'll happen. It sounds like there's lots of good research that you're involved with being done in this area. So hopefully lots of new findings to come out of it. Thank you for speaking about this subject today. It's really fascinating, really important, obviously, because thinking about little children being impacted like this is, of course, a very heartbreaking topic. And it's good to see that there's lots of work being done to address it.
Thanks so much. I think it's important. Communications is important. Spreading the news is very important, and educating both families as well as caretakers alike are very important. So thanks for giving me this opportunity to chat with you and be able to share some of this, some knowledge that we're learning and we continue to learn. So I'll look forward to updating this when we have more answers.
Perfect. Sounds good. Thank you so much again.
Thank you. Okay. Bye-bye.